Hi, I'm Hannah Casal, a nurse practitioner student at Auburn University, here in the clinic today with a mother who called with some concerns about her daughter, so we're going to meet them now. Good morning, what's going on?
Good morning, thank you for seeing us. I'm just really concerned about Haley. I can't get her to eat anything. She wants to work out all the time. She's complaining about a headache.
Hey Haley, can you tell me exactly what's going on lately?
I'm fine. I don't like to eat a lot, and I like to work out and stay healthy, and I don't see what the problem is with that.
The problem is you've lost about 20 pounds in the last month and a half, and I can't get you to come out of your room. You want to work out all the time.
Let me just do a quick assessment, but I think I have a pretty good idea about what could be going on here. As you can see, her eyes are very dark and sunken. She's got the bones protruding here. In triage, I'm looking here, her blood pressure and her temperature were low. Haley, you reported an episode where you recently felt dizzy and fainted. I'm going to listen to your heart. Sometimes electrolyte imbalances can cause some changes to your cardiac heart rhythms. When was your last bowel movement?
A week ago, probably.
Okay, so you are constipated. Tell me, when was your last period? Very irregular. Okay, so based on these symptoms, I am concerned about anorexia nervosa. Anorexia is an eating disorder where patients tend to focus on eating. They're obsessed about calorie intake, excessive exercising, about their weight, feeling like they're constantly overweight when they're not. So there's a couple of types. There is restrictive anorexia, where they restrict calorie intake, as in Haley's case. Then there is also binge eating and purging anorexia, which is more like bulimia. Females are at a higher risk for this disorder, unfortunately, especially actresses, models, and athletes, where there is an increased pressure to maintain a certain body image. It is unclear exactly what causes anorexia. Some doctors will tell you it's an imbalance with hormones and how your brain controls mood, appetite, and thought processes. There's also some suspicion, for predisposition. It runs in families at times. So diagnosis of anorexia is strictly based on symptoms, and I do feel like in your case that that's what's happening here. So I'm going to prescribe you with an SSRI or an antipsychotic, just to help ease some symptoms of anxiety and depression. And as far as treatment, I'd like you to follow up with a nutritionist and a psychiatrist as well, okay? Any other questions for me today?
No, just thank you very much for seeing us. I was afraid this was what it was.
Okay.
Can we go? I just want to work out.